Two.
John Murray's medication list. He's on metconazole nitrate 2%. Apply quarter-sized amount to, topically to the groin area once daily in the morning, and is an antifungal. He has acetaminophen 650 milligrams once every 4 hours as needed in the G tube when he has a temperature greater than 101 or he has pain. Special instructions: you may crash medication, contact MD for temperature greater than 101, not to exceed 3 grams Tylenol per day. Do not take within 2 hours of ibuprofen. He takes the amantadine, 100 milligrams twice daily via G tube for tremors, may crash medication. Baclofen 10 milligrams once daily at bedtime via G tube for spastic hemiplegia affecting right non-dominant side. May crash medication. Check respiratory rate before giving. Hold for respiratory rate less than 12 and contact 911. He also has baclofen 20 milligrams twice daily that you would give via the G tube. He has a suppository for 10 milligrams per rectum for constipation as needed daily. He's on carbidopa-levodopa for post-traumatic seizures, 25 milligrams per 100 milligrams 3 times daily via G tube, and you may crash medication. He's on the children's ibuprofen suspension, 100 milligrams per 5 ml. He takes 30 ml every 6 hours as needed via G tube for temperature greater than 100. Strength of ibuprofen should be 100 milligrams per 5 ml. And to contact MD for temperature over 101 Fahrenheit, do not take within 2 hours of Tylenol. He has the desmopressin acetate solution, and the VNA is responsible for that. The dose is 0.25 micrograms once daily in the morning and 0.5 micrograms once daily in the evening, subcutaneous for diabetes, and the VNA is to administer that. He has an enema disposable to be applied per rectum. He is on the hydrocortisone 15 milligrams once daily in the morning via G tube, may crash medication. He's also on the hydrocortisone 5 milligrams once daily at bedtime via G tube, may also crash medication. He's on the Keppra solution 500 milligrams per 5 ml. He takes 1500 milligrams twice daily via G tube for seizures. He's on the levothyroxine sodium 100 micrograms once daily in the morning via G tube for low thyroid hormone. You may crash the medication. He takes the Jevity 1.2 cal liquid 100 ml per hour every day from 5 p.m. and turn off at 8 a.m. Via G tube is a nutritional supplement using the Kangaroo e-pump. Staff may be trained on G tube per MAP policy. He's on loratadine 10 milligrams once every 24 hours as needed via G tube for allergies. May crash medication. Contact MD for allergies accompanied with increased body temperature or other signs and symptoms of illness. At night, he's on melatonin 3 milligrams once daily at bedtime as needed for insomnia. He's on milk of magnesia 500 milligrams per 5 ml. He takes 30 ml once every 24 hours as needed for constipation via G tube. Strength of mist should be 400 milligrams per 5 ml. He has the OcuSoft Lead Scrub Pad. Apply 1 pad to each eye twice daily, topically to both eyes for eye drainage. He has the Polytrim solution 10,000 0.1%, 1 drop to each eye every 6 hours for eye drainage. He has the testosterone outer UD 50 milligrams per 5 ml gel. He takes 50 milligrams once daily in the morning, topically to the shoulders and upper arms for panhypopituitarism. He has triamcinolone 0.1% cream. Apply a dime-sized amount twice daily, topically to the rash on the skin of the arms and back. He's on the valproic acid solution 250 milligrams per 5 ml. He takes 750 milligrams twice daily via G-tube for seizures. Please give 15 ml. He takes vitamin C 500 milligrams once daily in the morning via G-tube as a supplement, may crash medication. Vitamin D3 1000 units once daily in the morning via G-tube, also a supplement, may crash medication. Zero powder, quarter-sized amount, to be applied topically to the trunk once daily in the morning into the trunk because it's an antifungal. Check pain level every shift and document on medication sheet. We check fingernails twice a week on Monday and Thursday in the morning for monitoring. Clean nails twice a week with alcohol swabs, making sure to get underneath the nail bed. Trim as needed. Follow the seizure protocol by calling 911 for any seizure activity. Document on the seizure log. Individual John is NPO, nothing by mouth. All food and fluids are taken via G-tube. Due to dysphagia. Water flash 300 ml every 3 hours via G-tube for hydration and tube patency. Staff must be trained on G-tube per MAP policy. Change feeding bag and tube daily in the evening. Once a day in the evening before 5 p.m. feed. For dysphagia, staff must be trained on G-tube. Change peg tubing dressing every evening with normal saline once daily in the evening before 5 p.m. Feed. Wash G-tube site with normal saline. Apply gauze and tape in place. Monitor for signs and symptoms of infection around peg tube site. If any redness or skin breakdown is noted, please notify MD. Please check the blood pressure. Notify MD if systolic blood pressure is greater than 150 or less than 90, and or diastolic blood pressure is greater than 90 or less than 60. The pulse, please notify MD if heart rate is greater than 100 or less than 60. Check the oxygen saturation once every shift for hypoxia and notify MD if it's less than 90. Check the temperature, notify MD if the temperature is over 101, and administer medication as ordered. Bowel monitoring should be done once every shift for constipation. Monitor bowel movements every shift and document on medication sheet. Administer PRN medication. John has a condom catheter on at all times, 24 hours a day for incontinence. Replace condom catheter every day or if it falls off. Monitor penis for redness or irritation from the catheter and notify MD. Blood draws to be done by the VNA twice a week on Monday and Thursday for hypernatremia to check for electrolyte imbalance. Wash both eyes with warm water every morning and use a soft washcloth to gently wash John's eyes with warm water. Repositioning. Turn and reposition every 2 hours while in bed. May reposition more frequently as needed. Encourage John to spend time in his wheelchair and reposition in chair as needed. He has a shunt protocol. Monitor for signs and symptoms of headache, double vision or sensitivity to nausea or vomiting, soreness to the neck or shoulder muscles, low gradient temp, seizures, sleepiness, redness, or tenderness along the shunt tract, confusion or loss of memory, and changes in mood such as irritability. And that is